Good morning. The South Shore's Morning News rolls on. I'm Rob Hakala with the morning team, and it's time now for our monthly Croi Health segment. We do this once a month in studio with our great friends at Croi Health. And joining us as always, we have the CEO, Renee McInnes. She is in studio. You can also catch us on the YouTube feed as well. WATD Radio on YouTube. Welcome. Renee, good morning.
Hi, how are you, Rob?
Doing very well. Good to see you here.
You too. Thanks for having us back. Yes, happy April.
And I understand, as always, you brought another special guest with you?
Yes, I do. I have Sharon Walsh, a registered nurse that works at Croi Health, and she is the lead advanced illness case manager overseeing the limited prognosis program for end of life. So that's a lot to say.
It is indeed, yeah.
Good morning, Rob.
Morning. Good morning. Nice to meet you, Sharon.
You too.
Yes,
Thanks
I'm
for
going to
having
have
me.
Sharon talk a little bit about what I just said. What does all that mean?
Yeah.
And how does it tie into what we do at Croi Health? So.
Okay.
Thank you. So what I do is generally support all service lines within Croi Health, but mainly focusing on the home health team and the patients that fall under that category. So out of about 700 patients, my team deals with about 200 of those patients, which we have labeled limited prognosis patients. And those patients come to us with advanced illness, progressive diseases, chronic illnesses such as metastatic cancers, advanced cardiac, advanced pulmonary, neurological diseases such as ALS, MS, Parkinson's, dementia, any of those illnesses that are progressive in nature that are not going away. So we try to support those patients by looking at them holistically, by taking those puzzle pieces of a patient and making a clear picture for the team that's going out to the home and deciphering how we can best help and support that team, patient, and family. So we review charts. We have a guideline for our intake team to label these patients and kind of send them down the line so my team gets them. And we do a deep dive. We review these patients. Like I said, we provide a summary for the team that's in the home, and we add any additional supports that the patient might benefit from, such as the nurse practitioner from the palliative team, social services, speech, anything that might have not been on the original referral that we think, after review, the patient could benefit from.
Okay, so you take a look at each individual case. Obviously, there are specific conditions that we talked about that are progressive, but then there are also unique, might be a unique challenge or issue with an individual person.
Right.
And that's where you tailor that
Very
treatment.
specific, yes.
Okay.
Right. And looking at, the overall healthcare industry and what really are the gaps, right? So in collaboration and communication, and a lot of times these patients have not really had a conversation with a medical team about what are their goals of care for their end of life or for their disease progression, or how do I stay home and have quality of life with support. So this is what Sharon and her team do, supporting also the other team members that are in the home with these patients to work with their care team, meaning their physicians, whether it's their primary care physicians or their specialty physicians, to really understand how do we keep these patients, number one, out of the hospital, back and forth, where they don't want to be.
Yeah.
And how do we support them at home, but also educating them about support of whether we call it palliative or a serious illness, it really doesn't matter, right? At the end of the day, they need support. So that's really what the program aims at doing. And it's really the future of, where Medicare and Medicaid is going as well, looking at what does it mean for people with chronic disease and how do we, of course, they're looking at lowering costs, right? How do we not only lower costs, but improve outcomes for patients and families? So this is hopefully a program that's going to do that.
Wow.
And exactly. And that's what we've discovered is this is just really starting communication and education for patients, families, and even clinicians, just elevating that skill set to try to have these serious illness conversations. Like Renee said, a lot of times we are the people that are initiating these serious illness conversations. And what does this disease look like for you? You might be undergoing treatment now. If there's no longer a benefit to that, what does that look like for you? Have you thought of Plan B? I mean, it's really just opening up the conversation to look at the future.
And it says also that you will speak directly with in-home caregivers to understand the full picture, because as you talked about, it might not be the same that you have on the piece of paper in the file, right?
Oh, exactly. What a patient might look like to us on paper might be completely different to what the team in the home is seeing. So there's a lot of communication within the interdisciplinary teams. We actually have meetings biweekly with all of the interested parties on all disciplines to review these complex cases and to make sure we're on the right path, that we're all having the same conversation with patients and families. So the people in the home are critical to the conversation. What they're seeing might not match what we're seeing on paper. So those communications are vital.
And I imagine, obviously, we're talking about the person that's getting the care, but also I would imagine speaking with those that must make, if it were my family member, I would feel a little bit better having you come in and talk to myself and other caregivers. I imagine that gives them a little bit of a feeling that someone is looking out for their loved one.
Absolutely. These conversations with the caregivers, whether they be family or friends or, all interested parties, are so important because there's a fear around advancing illness and disease. So we have to try to break down those walls and make this more of a normal conversation. And we only get better at this conversation the more we have it. So, there's definitely kind of an exhale from family members and caregivers when we start to discuss these issues.
Yeah. And the possible of what is to come, because you have been there before, so you can give me a little insight into this particular, whatever the long-term condition might be.
Exactly. Right, we owe it to our patients and families as professionals to bring to the table all of our knowledge, because this is the first time they're going through it, but we have, a whole supply of information and education that we can hopefully help guide the trajectory, the conversation. It's really important.
Wow.
Yeah, and something our industry really is trying to do is get better at our messaging and communication for the average consumer and family around what this all means. It's very confusing to people. Even our healthcare partners don't always understand what we're doing when we say serious illness, limited prognosis, palliative care. It's like, well, exactly what is that? Yeah. So it's confusing for people. I think the most important thing is not listening to maybe the words or definitions, but we're here to support you in your goals of care at home where you want to be. And so how does that work? And for families, we do get a lot of questions when Sharon and her team call the family before, obviously, we send anybody out to meet with them, to really discuss these things with them. And it might be the first time they've ever heard it. And it is scary to say, well, what do you mean goals of care for my end of life?
Yeah.
But we should be talking about that when even before we have a serious illness. So,
yeah, it's really important to have those conversations in a non-urgent atmosphere. We don't want to just be doing triage. We want to actually have, a really nice conversation in, like I said, when it's not so imminent that things are changing. We want to make a plan. We want to have people have independence to do that. And if we're in the throes of a crisis, it's, you're really just dealing with that issue and not the planning of it.
It's a tough thing. I feel it goes back to human nature, whether it's a problem in our house or car. We always, should be thinking ahead and, including our life or our loved ones. But it's so easy, just problem here. I got to take care of this. What am I doing? And my head's spinning.
100%.
And it comes around, and it's so hard to, to kind of get out of that sometimes, I think, because we're all guilty of that. I know I am too sometimes, but it's so important to know that there are, people like yourselves, our friends and neighbors that can help us. So it's so important. I know we talk about it, but get started and have those conversations, right?
Right. It's even with many people we see, they don't have a will, or who wants to sit down and do a will because you're
even
thinking about
proxy.
A healthcare proxy.
No, it's something very simple, and it's all about planning and anticipating rather than reacting.
Yeah. And understanding what the role of the healthcare proxy is.
Yeah.
And really, who do you want as your healthcare proxy and your alternate healthcare proxy? It's very important because it plays a major role when you're sick.
Yeah.
So,
Yeah, for sure.
Well, for more information, of course, we always go to croihealth.org. That's Croi Health, formerly NVNA and Hospice. They're now Croi Health, croihealth.org. The website has a lot of information. You can reach out and connect there. And, of course, Renee McInnes and her team. Renee is the CEO of Croi Health. And, of course, we've also been meeting Sharon. Sharon, it's been wonderful to have you in studio as well.
Thank you for having me.
Thank you so much.
thanks, Rob. See
All
you
right.
next month.
Talk to you next month. Once a month, we go through these topics. And by the way, as well, if you want to reach out and there is a topic that you would like covered in a future segment, feel free to reach out to us. You can do that through my email or text us at WATD at 781-837-4900, and we can answer a future question or topic at 781-837-4900. That is our text line. Croi Health.